You are involved with an observational study trying out the short course regimen for drug-resistant TB. Can you tell me what it is you're doing?
We have some information from Bangladesh since few years that we can treat the multi-drug resistant tuberculosis cases with a shorter regimen than what is currently recommended at the international level. And this recommended regimen is for 20 months, and we are trying to treat the people in 9 months.
Now, what are the practicalities, though, of making it work in 9 months instead of the guidelines 20 months?
9 months is much shorter than 20 months, and that is a crucial issue. It's very complex to treat these people in the way that they have to take a lot of different drugs. And as you know, I'm doing the same thing. When I have a lot of drugs to take, I select among these drugs because I think that's too much. And when you select, that is a very bad way to do the things, and you take a risk to increase the resistance of the bacilla. So when you do that for 9 months, instead of 20 months, you secure the results of your treatment if the treatment is working.
So how far have you got so far? What are you doing?
So the interest of this study is also we are working in 9 different countries, in sub-Saharan African countries. So it's 9 countries, so 9 different setups, with people with HIV also, which was not in Bangladesh, where this regimen was discovered some years ago. And we have about 20% of the people are HIV positive. So we want to see if it works among HIV positive patients also, and to have experiments in more wider environment than just Bangladesh.
Now, one way of trying out a new regimen is to try it out in half the people and then a randomized section of people who are randomly divided to get a controlled treatment or the regular treatment. You're not doing that. Why?
No, we are not doing that. And it's a very different study. It's very important to do this kind of study, which we call the controlled clinical trial, randomized clinical trial. But this study, you have results much quicker, and you see if it works or it doesn't work. It's not scientifically totally sure. The results are not scientifically totally sure. You have to do really a controlled trial. But there you have 9 countries, and I hope a lot of other countries will be able to use this treatment very, very soon after we have the first results of this study.
What sort of evidence do you have already, both from Bangladesh previously and now with your own experience and some experience elsewhere, that these short regimens could be the way forward?
We have now more than 500 cases from Bangladesh showing that it works. So that's already an important study. And we studied also in Benin and Cameroon a bit longer treatment on 12 months, and we had more than 90% success rate, which is much, much better than what we have at the international level, the currently recommended regimen, which gives 50% cure rate only. So we are quite confident. The results for the moment, we are still, including the patients, the very preliminary results show we're going the same way.
Right. Now, one of the key issues, as you mentioned, is that people forget to take their drugs or prioritize between drugs. How are you making sure within the 9 months regimen that patients take their medication?
We pay a lot of attention to that, and I think that should be done everywhere. Patients swallow the pills every day in front of somebody from the health system, every day. So we try to make that as easy as possible for the patient, but it's a lot of work we ask for the patient, and it's a lot of work also for the health workers. But they swallow every day all the pills in front of a health worker for 9 months. You discuss that at the beginning with the patient, they agree, we never had the refusal, and we have so far an excellent follow-up.
Okay, briefly, what are the lessons that you could pass on already? Clearly there will be more when the observation is complete, which is not too far in the future.
I think that is really the revolution somewhere. We have new drugs arriving on the market, and that's great, but this regimen is not using new drugs, very cheap regimen, and working very well. And I think in a lot of countries should go for this regimen already.
So what's the take-home message for healthcare workers dealing with TB, especially drug-resistant TB right now?
Well, the problem is to avoid to create drug-resistant TB. That should be the main message. if you treat correctly the TB the first time, you will not develop multi-drug resistant TB. If you don't treat correctly, you will develop, and that is the problem.
But if you do get faced with this, then it looks as if the short regimen could help?
That's for sure. You can treat and cure the people in 9 months. You have to pay a lot of attention. You have to do that very correctly. Otherwise, you will develop more resistance to the bacilla, and that begins to be very difficult to cure.